care supplies covered? And are they billable by insurance companies? Several times I talk to physicians and they say that they don't dispense wound care supplies because they can't get them covered, or the insurance company hasn't paid, or their biller says it's not a covered benefit. I am here to tell you that wound care supplies are indeed covered by most insurances, and they can be paid, but they have to be billed and dispensed correctly. So how do you bill and dispense wound care supplies correctly? First of all, if you are treating a patient that has red, white, and blue traditional Medicare, they do not have a replacement plan. It is not an HMO. It is just traditional red, white, and blue Medicare. You can dispense wound care supplies the same day. Now, if you have a replacement plan or you have any other type of insurance, whether it's Blue Cross Blue Shield, United, Humana, those wound care supplies must be dispensed the next day so that there is separation of services. So that can either be, you can use patient direct through Amerix, or you can have the patient come back in the next day and dispense those wound care supplies. Okay, that can be one of the reasons as to why wound care supplies didn't get paid, is because they're trying to bundle it with your debridement. Now, another tip for getting wound care supplies paid for is going to be that you do not add any other modifier except the A1 or A2 or A3, depending on how many wounds the patient has. And that you're using a diagnostic code for a chronic ulcer, not a pressure ulcer, a chronic ulcer. So, wound care supplies are covered. Okay, they are covered by the majority of insurance companies. Okay, Medicare you can dispense same day if they're not on home health or hospice. All other insurances, it is best practice for you to dispense it the next day or use the patient direct program through Amerix. You also want to make sure that you're using an A1, A2, A3 modifier, no KX, no left, right, and that you're using a diagnostic code that is appropriate for wound care supplies, which is going to be a chronic ulcer. If you have any questions or concerns, feel free to reach out to Amerix and we will be happy to help you. My name is Holly Berkman, and I am a practice management consultant. I also run numerous podiatry practices and wound care clinics, and we bill for wound care supplies almost on a daily basis. So in my personal experience and in the clinics that I run, wound care supplies are covered, they are payable, and sometimes they just need to be billed a little bit differently. And as always, to your continued success.